A corneal abrasion, commonly known as scratched eye, is a common eye injury that occurs when the cornea gets scratched or damaged. The cornea is the clear, protective outer layer of the eye. It is like the window of the eye, covering the iris and pupil, and it's a crucial part of our vision system, helping to focus light as it enters the eye. The cornea consists of 5 layers, with the outermost layer called the epithelium. This layer is only about 5 to 6 cells thick, making it incredibly thin and susceptible to damage. When we talk about a corneal abrasion, we're typically referring to a scratch or damage to this epithelial layer. While it may seem like a minor injury, it can be quite painful and disruptive to vision. Corneal abrasions are quite common. In fact, they're one of the most frequent eye injuries that eye doctors encounter. It's estimated that corneal abrasions account for about 10% of all eye-related visits to emergency departments and urgent care centers. Anyone can get a corneal abrasion, but they're more common in people who wear contact lenses, work in dusty environments, or participate in certain sports. Causes of corneal abrasion. The causes of corneal abrasions are diverse and often related to everyday activities. One of the most common causes is accidentally poking your eye with a fingernail, either your own or someone else's. This can happen during sleep, while rubbing your eyes, or during activities like applying makeup. Other common causes include getting sand or other small particles in your eye, which can scratch the cornea as you blink or rub your eye. Contact lens wearers are at a higher risk of corneal abrasions. Wearing lenses for too long, using poorly fitting lenses, or inserting and removing lenses incorrectly can all lead to corneal damage. Sometimes, a tiny chip or tear in the lens can scratch the cornea. Sleeping in contact lenses, especially if they're not designed for overnight wear, can also increase the risk of corneal abrasions. Certain activities and occupations can put people at higher risk for corneal abrasions. For instance, people who work with power tools or in dusty environments are more likely to get foreign objects in their eyes, which can lead to abrasions. Athletes, particularly those who participate in contact sports or sports that involve small, fast-moving objects, like tennis or racquetball, are also at increased risk. Even seemingly harmless objects can cause corneal abrasions. Tree branches, paper edges, makeup brushes, and pet claws are all potential culprits. In some cases, harsh chemicals splashing into the eye can cause chemical burns that result in corneal abrasions. Symptoms of corneal abrasion. The symptoms of a corneal abrasion can be quite uncomfortable and are often described as feeling like there's something stuck in your eye. The most common symptom is pain, which can range from mild discomfort to severe pain. This pain often gets worse when you open or close your eye, or when you're exposed to bright light. Many people with corneal abrasions experience a gritty or sandy feeling in their eye, as if there's a foreign object present even when there isn't. This sensation can be constant and quite irritating. The affected eye often becomes red and watery, as the body produces more tears in an attempt to flush out any potential irritants and promote healing. Light sensitivity or photophobia is another common symptom. People with corneal abrasions often find bright lights uncomfortable or even painful. This sensitivity can make it difficult to be outdoors or in brightly lit rooms. Vision changes are also common with corneal abrasions. Your vision might become blurry or hazy in the affected eye. Some people describe seeing a slight halo effect around lights. These vision changes occur because the scratched cornea isn't as smooth as it should be, which affects how light enters the eye. Many people with corneal abrasions find themselves blinking more frequently than usual. This is often an unconscious reaction to the discomfort and the feeling that something is in the eye. Some also experience involuntary tearing or a discharge from the eye. It's important to note that the severity of symptoms doesn't always correlate with the size or depth of the abrasion. Even a tiny scratch can cause significant discomfort. The location of the abrasion on the cornea can also affect the symptoms. Abrasions in the center of the cornea, which covers the pupil, tend to cause more vision problems than those on the periphery. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of corneal abrasion. Diagnosing a corneal abrasion typically involves a visit to an eye doctor or an emergency room. The doctor will start by taking a detailed history, asking about recent activities that might have led to eye injury and about the symptoms you're experiencing. The main diagnostic tool for corneal abrasions is a thorough eye examination. The doctor will likely use a special microscope called a slit lamp to examine your eye in detail. This allows them to see the surface of your cornea clearly and identify any areas of damage. To make the abrasion more visible, the doctor might use a special dye called fluorescein. This dye is usually applied as eye drops and doesn't hurt. When illuminated with a blue light, the dye will highlight any damaged areas of the cornea, making them appear green. This technique can reveal even tiny scratches that might not be visible otherwise. In some cases, the doctor might gently flip your upper eyelid to check for any foreign bodies that might be hidden there. They might also check your vision and test how your pupils react to light. Treatment for corneal abrasion. In most cases, corneal abrasions heal within a few days, but treatment is important to prevent infection and promote healing. One of the first steps in treating a corneal abrasion is removing any foreign objects that may still be in the eye. If there is something stuck under the eyelid or in the eye, the doctor may need to flush the eye with saline or use specialized tools to carefully remove the object. It's important not to try to remove the object yourself, as this can cause further damage to the cornea. Since the cornea is very sensitive and vulnerable to infection, especially when it has been damaged, the doctor may prescribe antibiotic eye drops or ointments to prevent bacteria from entering the wound. In some cases, they may also prescribe steroid drops to reduce inflammation and help the eye heal more quickly. These medications are usually used for a short period until the abrasion heals. To reduce pain and discomfort, doctors may also recommend using lubricating eye drops or ointments. These help keep the eye moist and reduce friction between the eyelid and the corneal surface, which can make blinking more comfortable. In some cases, a doctor may recommend using a special contact lens, called a bandage contact lens, to protect the cornea while it heals. These lenses act as a barrier between the eyelid and the corneal surface, reducing pain and promoting faster healing. It's crucial to avoid rubbing the injured eye, as this can make the abrasion worse or introduce infection. The doctor will likely advise against wearing contact lenses until the eye has fully healed and they've given you the okay to resume wearing them. For chemical abrasions, immediate and thorough irrigation of the eye with saline solution or clean water is crucial. This should be done as soon as possible after the exposure and continued for at least 15 to 30 minutes. After irrigation, these cases should always be evaluated by an eye doctor. In most cases, corneal abrasions heal within 24 to 72 hours. However, larger or deeper abrasions might take up to a week to heal completely. Now, we want to hear from you. Have you ever experienced a corneal abrasion or other eye injury? How did you manage the pain and recovery process? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.